walk in the room, I'm going to introduce myself. I'm Jennifer Anderson. I'm a student nurse. I'm going to do a respiratory checkup on you today if that's okay with you. Okay, I'm going to obviously wash my hands before I touch my patient. And so the first thing I'm going to do is I'm going to tell you about some normals. So normally I would assess your respiratory rate. That normal for an adult is 12 to 20 breaths per minute. And I would also normally assess your rhythm and whether it was regular or irregular, and if you were using any accessory muscles to breathe. And then I would also check the depth of respiration. That can either be shallow, moderate, or deep. Shallow means I would not see a lot of rise and fall in your chest. Moderate is considered normal, and deep would mean I see a lot of rise and fall in your chest, and it would be obvious to me you're working hard to breathe. So the first thing I'm going to do is I'm going to assess your transverse to your A and P diameter, and I do see that you're 2 to 1, so that tells me you do not have a barrel chest. And I do not see any lead, maybe one scar right here on the back posterior. I do see some scattered freckles. I see just some, maybe a little bit of hair, just some fine hair. Your skin color is pretty consistent with that of the rest of the body. And then I'm gonna look at your lips and your mucous membranes. Your lips, they're pink and moist. Could you open? Well, there you go. Okay, your buccal mucosa is also pink and moist, and there's no cyanosis. So now what I'd like for you to do is I could borrow one of your fingers. Okay, so your nail bed is pink. Your nail's slightly convex. Could you take your fingers and do like this for me? Okay, so I do see a diamond, so that indicates to me that your nail beds are less than 160 degrees, so you have no clubbing. And then lastly, if I could take your fingernail one more time, I'm going to press on it, release it, and your capillary refill time is less than 3 seconds, so that is also normal. Now I'm going to palpate your thorax. My hands might be a little bit cold. Oops, sorry. Okay, so there was no crepitation noted. So I'm going to check for chest expansion. So I'm going to place my hands right here. Would you take a deep breath in and out? Okay, perfect. I can do it on the back as well. Okay, if you do the same thing. Okay, equal and symmetrical chest expansion noted both anteriorly and posteriorly. So the next thing I'm going to do is I'm going to auscultate your breath sounds. And so as I touch you, if you just take a little bit deeper breath than normal, but I'm going to be moving kind of quickly for the check-off, so you don't have to breathe to where you feel lightheaded, but if you would, just take a little deeper breath than normal. Okay, if you could turn around for me. All right, great. So you can turn around. So I'm going to tell you everything that I heard. So the first thing I listened to was your bronchial breath sounds. That was located over your trachea and your larynx. Those are high pitched, they are high intensity, they are located anteriorly only, and inspiration is less than expiration. So then I listened over the center of your chest. I listened to the bronchial vesicular sounds. That's going to be anteriorly and posteriorly. They are moderate pitch, moderate amplitude, and inspiration is equal to expiration. And then I listen to your vesicular breath sounds. Those are your peripheral lung fields. They are also located both anteriorly and posteriorly. They are soft, they are low pitched, and inspiration is greater than expiration. But as I listened to all those areas, what I heard were your breath sounds were equal bilaterally clear to auscultation. I did not hear any adventitious breath sounds, but if I did, an adventitious breath sound example could be wheezing, which would indicate that you might have asthma, or I could have heard crackles, which could indicate pneumonia. And that concludes my respiratory exam. Thank you so much. I appreciate it. You're awesome.